Last week, we told you that the globe has reached 2 million COVID-19 cases. Since then, the number increased by over 600,000. So that's over 500,000 in just 7 days. And while there is a war on the novel virus, there's also a war of words and accusations over who's to blame for the virus and its rapid spread. We're in conversation this evening with the Deputy Secretary General of the United Nations, Amina Mohammed, and we bring you a special dual broadcast between the SABC and the Chinese Global Television Network. Good evening, I'm Aldrin St-Pierre, and this is African Perspective. The World Health Organization says it's concerned about the rapid increase of COVID-19 cases in Africa, Central and South America, as well as Eastern Europe. Addressing a virtual media briefing in Geneva, Switzerland, the organization says while the number of cases in some Western European states seem to be declining, some countries are also seeing a resurgence in infections. However, the World Health Organization says it has commended some of the countries on the continent, including South Africa, for their strategies.
Africa has a strong track record in doing such work, and I'd like to congratulate the institutions in DR Congo especially, and Jean-Jacques Muyembe and his staff, because we have a monoclonal treatment which is highly successful for Ebola now, and that was developed in Congo with collaboration with NIH in the United States, but has been one of the first proven therapeutics against Ebola, a life-saving intervention developed in DR Congo and has been used successfully to treat in the last outbreak. Again, there is a tremendous amount of innovation going on in Africa in general. Maria mentioned South Africa. And again, it is interesting the way in which South Africa is bringing the disease under control, and how African countries are actually in some ways showing the way. The strategy in South Africa was based on preparation, primary prevention, lockdown and enhanced surveillance. 67 mobile lab units around the country, 28,000 community health workers trained in case detection, I think over 120,000 tests completed with a 2.7% positivity rate, which is incredible, that much testing for that return. So we're seeing performance levels there again, congratulating the government and institutions of DR Congo for the superb way in which Ebola has been brought under control. We still have some way to go. So I think in general, we need to leverage the capacities that exist in Africa, the innovation, the science. We need to connect those scientists. We need to connect those laboratories, those clinicians across Africa. Again, the Director General, working with our Regional Director, Chidi Moeti, and the African Union, have been heavily engaged in trying to drive innovation, both in the public and the private sector across Africa. And it will be very important that studies in Africa are led by principal investigators from African institutions, and obviously reaching out to collaborators in other parts of the world. And I trust that those capacities exist. And again, to point to the rapid evolution of capacity. At the beginning of this epidemic, and I will point to the fact that WHO began distributing validated testing kits in Africa on the 24th of January, which was 7 days, 8 days a week before the declaration of the global public health emergency. But it was the laboratories at Institut Pasteur in Senegal and NICD in South Africa that trained all of the laboratory technicians from all over Africa, who then met up with their new reagents when they returned home. We're also seeing the use of high-throughput diagnostic systems in places like Kenya, where superb technology that's been provided by the Global Fund and others has been repurposed to use for high-throughput diagnostics in many African countries. We're working very closely with the Global Fund, with UNICEF, with UNITAID, to accelerate the availability of reagents for those high-throughput systems. So I think we're seeing very, very good things happen, but we're very cognizant of very cognizant of the challenges. We've seen almost 250% increase in cases in Sudan in the last week, in Somalia nearly 300%, and in many other countries like Tanzania, Mali, Congo, Gabon, Equatorial Guinea, Capo Verde and Eritrea, increases of more than 100% in the last week. But many other countries in Africa, case increases somewhere between 30 and 90%. So we are at the beginning in Africa. I believe that with a focus on preparation, on surveillance, on community mobilization, and on the undoubted capacity for innovation and science in Africa, that we can avoid the worst of this pandemic. But we are also cognizant, as the DG said, that there are lives and there are livelihoods, and the impacts of long-term lockdowns are having a severe impact. So we have to find a way forward in Africa that can balance the risk of the virus against the risk to people's livelihoods and people's lives at the same time.
And as you would know, that African states are in collaboration with various countries to try and find a solution to COVID-19. And no different is the Asian tiger, China. The relationship there has strengthened after the Chinese established FOCAC. During these difficult times, China continues to support the continent. SABC News has teamed up with CGTN for a panel discussion on the COVID-19 pandemic. Do enjoy.
According to the World Health Organization's Africa office, COVID-19 was slower to reach the continent, but infections have grown exponentially in recent weeks. Africa already has expertise in fighting viral outbreaks, and Africans experienced lockdown procedures during previous outbreaks of Ebola and the Marburg virus. How could China and South Africa work together to battle COVID-19? For a special broadcast, Sophie Mugana from SABC will be co-hosting Dialogue with the World, explore these issues of concern with experts from China and South Africa.
In times of crisis, the continent and China have each other's assistance. And with this global pandemic, it has been no different. When the epicenter of the coronavirus was still in Wuhan, China, South Africa lended assistance by sending medical PPEs. And now that the virus has moved across the world, China is returning that favor.
And from China, we're joined by Dr. Gao Fu, the head of the Chinese Center for Disease Control and Prevention. Dr. Gao led China's mobile laboratory testing team during Sierra Leone's Ebola outbreak in 2014. And since then, he has continued to lead the CDC's efforts to strengthen public health security in Africa.
From Pretoria, Health Department's Deputy Director General, Dr. Jürgen Pillay. He is responsible for policy-making, implementation and monitoring of national programs in HIV and TB, as well as women and child health. Dr. Pillay is currently facilitating the re-engineering of South Africa's primary healthcare system. Thank you, Dr. Pillay and Dr. Gao, for being part of our dual broadcast.
Let me start with Dr. Pillay. As of April the 20th, 120,000 rather tests have been conducted in South Africa, while the WHO has said the testing and tracing context is essential. But how is Africa scaling up the testing in a country with more than 50 million people?
Thank you very much for the opportunity, and good evening to people in China and good afternoon to people in South Africa. Yes, indeed, we've done around 120,000 tests so far, and the intention is to scale up. One of the things we've done in the last 2 weeks is to send out community health workers to each of our districts, especially those that are considered vulnerable and where we think there are new infections. And they have screened more than 2 million people and referred more than 16,000 people for testing. We have the results now of an additional almost 7,000 people who have been tested from communities. This is in addition to people who pitch up at doctors' rooms and clinics asking to be tested because they are not feeling well. So indeed, South Africa is ramping up tests. We would like to move quite quickly to test more than 10,000 people every day in South Africa, because we think that by testing people finding out who's positive, isolating them, we will be able to then eliminate those small fires where there are small pockets of the virus and therefore prevent its spread.
And I know that your country is still in lockdown. How would you predict COVID-19 will develop in South Africa?
So we're in our 4th week of the lockdown, and we have another week to go. And I must say, led by our president, the country really is trying quite hard to ensure that people adhere to the conditions under lockdown, and that we start thinking about how we ease the lockdown so that we can return to work and that children can return to school. But as it was in Wuhan and in other cities in China, we think that the lockdown is critical to both prevent new infections, reduce deaths, as well as ensure that especially the elderly and people with comorbidities, other health conditions, are prevented from getting the virus. So we think that this is the right decision to do, and really we borrowed the idea from China, and we saw that the Chinese experience with the lockdown was very successful, and hence we also, the president decided that this was something we should do as well. So we've learned some lessons from China already.
Dr. Gao, you were on the front lines of the Ebola in 2014. The outbreak was experienced in countries such as the DRC. In terms of your knowledge of Africa's capacity to deal with infectious diseases, how do you think Africa's experience of battling previous infectious diseases or the outbreaks can help the continent to deal with this current outbreak or the pandemic, COVID-19?
In my opinion, because I visited Africa quite often for the last decades, since especially in 2014, I was in Sierra Leone. I worked together with my colleagues in Sierra Leone and also my Chinese colleagues there. I believe, I'm quite confident. And the Africa people and you guys are very, I think you guys, very experienced for fighting against those emerging and re-emerging viruses, including, Ebola, and also, Lassa fever. You experience so many viruses there, especially in South Africa. I mean, your capacity and the facility are quite good, in my opinion. So you will, gain something from your experience, from your facility and capacity there for the last decades you built up. Think about it in China at the moment. As Dr. Pillay said, you want to pick up some experience from China. So actually, we did something from the very beginning. We have 2 battlefields. I call 2 battlefields. One battlefield in Wuhan and Hubei province. That is a lockdown strategy. We also have some the rest of the China, except for Wuhan and Hubei. So there, we just, relatively, it's kind of, you can call it a lockdown, but more or less it's a mixture of lockdown and mitigation. But finally, with more than 2 months, we got the virus down, and for the last 1 month, we haven't got any virus there. So in my opinion, and China and Africa, definitely we can work together. We share the information. We share the experience. Definitely we can do something together. I'm confident about Africa.
What should the new agenda for Africa cooperation in line with the agreement with Africa and China be at the CDC level?
China-Africa cooperation is under the great leadership of the President Xi Jinping, and we have all this strategic collaboration. And for the war against COVID-19, definitely we can do something together, as I said already earlier. In my opinion, seeing the future, we can do something. For example, I mentioned sharing the data, and also we have some senior advisor working together in Africa CDC with Dr. John Kangaso, and we also have at least some attaché in some African countries' embassy. One of my colleagues, Dr. Ni Daxin, he's working in Zambia, and he's working very closely with Zambia CDC. So they are working so close that, Dr. Ni Daixi helped Zambia people there and set up all these kind of strategies to tackle this COVID-19.
Dr. Gao, I know that until we have a vaccine, probably the world won't get it over with, this disease. But a lot of people here in China and the rest of the world are wondering when the vaccine will be available, will it be fully effective? What is your take?
To develop a vaccine or specific drugs, it always takes time. So you are expecting we might be able to get a vaccine, but it takes time. It all depends because vaccine will be used for the healthy population. You want to make sure the vaccine you are developing is safe and infectious. Otherwise, can you really use a vaccine? Maybe it works. You don't want the word maybe. You want to make sure it's safe, it's infectious, and it really works for the people. In my opinion, the vaccine, of course, China, we are in the front line for the vaccine development. Maybe by September, we might have a vaccine to be used for emergency. For example, if we have some emergency outbreak again, you might be the new developed vaccine still under phase 2 or phase 3 clinical trials. It can be used for some special groups, for example, healthcare workers. So it all depends. In my opinion, maybe we might get a vaccine for healthy people early next year. That all depends how we are moving forward. Of course, people learn a lot from the past, so we know some of the strategies to develop vaccine will work. At the moment in China, we already have 2 vaccine candidates. They are under clinical trials. One is 1805-based recombinant vaccine. The other one is inactivated vaccine. They are under phase 2 or phase 2 clinical trials.
And Dr. Gao, a local transmission is probably the most threatening thing in Africa. And because of the logistics and financial restraints, many countries are facing difficulties in contact tracing, testing, and isolation. And they cannot afford to have lockdown like in Wuhan. So what are your suggestions for those Africans who are dealing with this kind of dilemma?
Yeah, that's really a dilemma. That's really, worries me. So once you have the patient, you have the cases in the local community, it will be very hard for you to get the virus down. So in my opinion, from experience from Wuhan, so the most important thing, because you want to stop the sources of the infection, you also want to protect the susceptible population. You also want to stop the transmission route. So those are 3 major factors you have to take care. For isolation or quarantine for the susceptible population and for the suspected cases or confirmed cases of the isolation. So that's very important. I'm calling for all the healthy people to try to wear a mask. Wearing it is very important, but very simple. So this is something I'm calling. Looking back, what we have done in Wuhan, and from the very beginning, of course, because this virus, we have so many things hidden. It's a really, I call it covered virus. They have a lot of characteristics we don't know. But once we know, this is a very special unusual virus. And in Wuhan, of course, isolation, quarantine, and treatment, they are all important, for those strategies. Non-pharmaceutical intervention, NPI, is a major strategy, including if you are in China, the traditional Chinese herbs, Chinese medicine. It also, in some cases, it works. So this is the only thing you can do, because you don't, as you said, you don't have the vaccine, nor special drugs. So the only thing you can do is the NPI.
And Dr. Pillay, about the therapeutic response, more than 1,000 patients I know have recovered in South Africa. What are the treatment and methods of being applied in your country? And is there any special ways you're dealing with this new disease?
So, the world over, unfortunately, we haven't got a cure for this virus. It's a very new virus, and scientists are still working on what works. We have joined the World Health Organization's Solidarity Research Program, to look at the different modalities of drugs that can be used. We are hoping through this collaborative multi-country study, we will have a better idea of what can work to cure patients. So currently the treatment is largely prophylactic. So patients are made comfortable and the symptoms are treated, but we really don't have a cure. And pretty much like Dr. Gao has said, we really are trying out different modalities to see what works. We have some ideas now of what doesn't work, like steroids, for example, don't work. So we are basically trying out various therapeutic regimens to see what works for different people. What we do know is that about 80% of people will have very mild symptoms, and for most of them, they won't need much in the way of medical treatment. There's another 20% that would need some level of hospitalization or medical treatment, and about 5–6%, based on the Chinese and other experiences, will need intensive care as well as ventilation. And that's where I think, as Dr. Gao suggested, we would need some additional support. There is not a lot of ventilators available globally. Most countries are manufacturing ventilators for themselves. So that's one of the areas that I think countries in Africa would need to invest more energy and resources, as well as in intensive care units, as well as the provision of oxygen. And I think those are the critical things that countries in Africa need to focus on to ensure that we don't have the kinds of mortalities that we saw in other countries. And that is key for us, preventing infections and decreasing the number of people who need hospitalization. And once they're in hospitalization, we need to be able to provide ventilation for those patients that need to be ventilated.
Does South Africa require help from other countries? If so, what kind of help is needed?
Sophie, thanks very much for that question. We are currently preparing for what we call the surge or the peak in the number of new infections. We are currently, as you correctly pointed out, we only have about just under 3,500 confirmed COVID positive patients. We suspect that there are a lot more undiagnosed, because one of the challenges around the world is the number of patients who are asymptomatic. We are only, of course, testing currently those that are symptomatic. As we expand our testing and test those that are non-symptomatic or asymptomatic, we will clearly find more patients. The key issue is preparation, and we are using the time now to prepare in terms of the number of ventilators we need, the number of hospital beds we need, the number of ICU beds that we need, as well as preparing our health workers to try and ensure that when we see the surge, the significant increase in patients, that our health facilities are ready to both accept them as well as treat them. In terms of what we need, and we are very grateful for China, who has recently donated personal protective equipment to us. We're very grateful for the PPEs that we received from China. But let me say that there's now a global shortage of PPEs, and there's also a shortage in South Africa. So any assistance that our friends in China can provide us with respect to PPEs, as well as reagents to test people and test kits, as well as ventilators, will be highly appreciated. And I'm sure I speak for other countries in Africa who have similar needs and will have similar needs as the number of cases in Africa grow. We are expecting, Sophie, that our cases will peak sometimes late in August, early September. We don't quite know how many patients we will get, but we think they will be considerable, and that's when our hospitals will be under significant stress in terms of coping with the number of patients we have. We are already constructing field hospitals, exactly like our colleagues in China did, as well as fever clinics. We had a teleconference with our colleagues in Shanghai about 3 weeks ago to also learn from the colleagues in Shanghai on how they dealt with the surge in the number of cases in Shanghai, both in terms of mitigation of transmission as well as testing and hospitalization. as well as how they dealt with hospitals, both in terms of the formal hospitals, the field hospitals, and the fever clinics. So we're very grateful now for the additional support we are getting through technical advice, even though it's virtual, it's remote, from our colleagues in China. The publications from China on their experiences is also helping everybody in the world, including South Africa. So we are learning quite a bit from the Chinese experience, and we'd like to thank the Chinese colleagues for that.
And Dr. Pillay, I want to ask something about communication. Of course, misinformation, fake news are the last things we want in the time of pandemic, but unfortunately a lot of rumors being spreading around. I know there is a campaign called Listen to Experts in South Africa. Tell us more about the campaign and how frustrating and encouraging are these efforts?
So in any response to any disease, any epidemic, communication to the public is critical. And the importance of communication lies not only in the volume of communication and how often we communicate, is in what we communicate and how we communicate. South Africa is a very heterogeneous country with multiple official languages spoken in different parts of the country. And I suspect it's similar in China too, which means that we have to communicate to people at all levels of education in multiple languages and communicate as simply as possible so that people really understand the gravity of the situation, how the virus is spread, what can be done to mitigate the spread of the virus, and also what the symptoms are so that people identify themselves as COVID symptomatic and go and get tested. So these are all things that we have a very strong campaign around, and we are using a multiplicity of channels to communicate, newspapers, social media, as well as television and radio as a main means of communication. We are also communicating obviously through our leaders, led by the President, and I think the South African community has really appreciated the updates from our President that he uses the television media and the radio media to communicate to the populace. So we are really stressing the importance of communication at all levels of society, but providing credible information, because as you said, there's a lot of misinformation and false information being provided, and it's very important for people to have scientifically based, evidence-based information on which to base their responses to this virus.
How can we ensure that all countries are able to share proper information, correct information?
Sophie, I think this is very important. You must be frank, you must be honest to share the data, to share the information. Like Dr. Pillay already mentioned about sharing the information not only for the countries, between countries or among countries, but also for the experts and the public. You know, if you have the wrong information, misinformation, or you have rumors, that those mixed up, you have an infodemic. That's a very good word, infodemic. So that's very important. I think, in my opinion, we should work together under the great leadership of World Health Organization. So this organization, we should work together under their leadership and to share the data and through the WHO. And also we can do some bilateral data sharing, like like now we are talking to each other to make sure you get though it's virtual, but you will get all the experience, all the data from us. I agree, keep everything transparent, take everything open, are very, very important to tackle this COVID-19.
I want to pin you down on this, Dr. Gao. Some people might say there is a balance between efficiency and accuracy of information. For example, when should the CDC announce the urgency of this problem to the world? Based on what kind of data should they be doing that? Is there anything that you think we should revisit this time?
Well, you are working on this is a public health issue. So you don't want to give the wrong information. You don't want to give something is not confirmed. So I think the same for China CDC and the US CDC. So I mean, because I talked to Dr. Robert Redfield, earlier when we even had this outbreak, we share the information. We share the experience we worked in the field. So, in my opinion, you have to share the information. It's confirmed. So, for all this public health, first, all the information must be science-based. And then, whatever information you release, you want to make sure the public would understand. You also want the public to be involved for whatever information you give. And more importantly, when you collect the public understanding, public involvement, and plus a science-based strategy, and then you will come up with some decisions. For the decision makers, they must collect all those data together, and then you will have a conclusion.
And Dr. Pillay, what do you think China can share with African countries in terms of how to deal with this COVID-19, and how do you see the end game will be like?
So, as Dr. Gao says, China has the benefit of, and of course the misfortune of being the first country in the world to have to deal with the virus. They, in a sense, discovered the virus. They've had to deal with the implications of the virus, both the economic implications of the virus, the social and cultural implications of the virus, as well as, of course, the health implications of the virus. So they've got a head start of all of us. So there's lots we can learn from our colleagues in China. And of course, China has a reputation and has a long experience of helping colleagues in Africa. So there is a footprint in Africa. They've been helping, as Sophie mentioned as well, the African CDC. So we expect ongoing collaboration from our colleagues in China on social, economic, cultural, and health-related aspects of dealing with the COVID virus, as well as dealing with the reconstruction not only of the African economy and the African social matrix post-COVID, but I think China has also a role to play in the rest of the world. And as Dr. Gao says, we have to all work through the World Health Organization, including the African Regional Office of the World Health Organization, and strengthen these multilateral organizations, because I think as we've come to realize with either Ebola, HIV, or now COVID, the world is a very small place, actually, and these viruses can travel very far and very fast.
We are all in this together, finally. Thank you very much, Dr. Pillay and Dr. Gao, for your important and consequential work. And thank you, Sophie. And that will wrap up this special edition of Dialogue. I'm Zhu in Beijing.
And welcome back. WHO Director General Tedros Ghebreyesus has warned against complacency. He says while the number of cases in some countries in Western Europe seem to be declining, some countries are also seeing a resurgence in infections.
Globally, almost 2.5 million cases of COVID-19 have now been reported to WHO, and more than 160,000 deaths. We see different trends in different regions, and even within regions. Most of the epidemics in Western Europe appear to be stable or declining. Although numbers are low, we see worrying upward trends in Africa, Central and South America, and Eastern Europe. Most countries are still in the early stages of their epidemics, and some that were affected early in the pandemic are now starting to see a resurgence in cases. Make no mistake, we have a long way to go. This virus will be with us for a long time. There is no question that stay-at-home orders and other physical distancing measures have successfully suppressed transmission in many countries. But this virus remains extremely dangerous. One of the greatest dangers we face now is complacency. People in countries with stay-at-home orders are understandably frustrated with being confined to their homes for weeks on end. People understandably want to get on with their lives because their lives and livelihoods are at stake. That's what WHO wants to, and that's what we're working for all day, every day. But the world will not and cannot go back to the way things were. There must be a new normal, a world that's healthier, safer, and better prepared. The same public health measures we have been advocating since the beginning of the pandemic must remain the backbone of the response in all countries.
Let's keep fighting together to stop the pandemic, support most vulnerable, and build a back better in solidarity. An optimistic tone set by the United Nations Deputy Secretary General in her message in the One World Together at Home broadcast event that took place this weekend, raising millions of dollars for the World Health Organization's COVID-19 Solidarity Response Fund. But as the DSG has also articulated, the pandemic and the measures to mitigate it are already having a very serious social and economic impact. Amina Mohammed joins us now via Skype from the United Nations headquarters in New York. DSG, good evening and welcome to African Perspective.
Good evening. Lovely to be with you.
Before we start off this conversation at DSG, we'd just like to extend our condolences to you after losing one of your colleagues who worked in the Nigerian presidency, Abba Kairi.
Yes, Abba Kairi was indeed one of the closest colleagues that we had, and it was a backbone in our cabinet, and we will miss him. But it shows you that COVID knows no boundaries. It can happen and be, anyone can be at the end of it.
Yeah, and saying that that it knows no boundaries, what do you make of the solidarity response that we've seen from the various states in trying to combat COVID-19?
Well, I think that certainly that it is a global pandemic, a crisis of the human face, and we've said that only a global response can deal with this. I think the intentions so far have been good. However, what is it that we have actually managed to see in the last few weeks, where we have engaged with the G20, where we have had the IFIs come together, and where we've had calls from African presidents on the necessity of a debt standstill? Some of the first collective steps, I think, have been very hopeful. But it's not enough, and we need to do a lot more to make sure that the liquidity, the gap that is needed to be filled in many developing countries is actually attended to. So a global response, I think that you're seeing everybody come around the table to try to do that, but there are many challenges to it to be worked out.
And how do you fill that particular gap? Looking at, for instance, what the United Nations Conference on Trade Development has indicated around the 1 trillion rand that should be made available through expanded use of special drawing rights at the financial institutions.
Again, I think that this is a very positive step, and Kristalina Georgieva is aware of some of those incredibly difficult situations everyone finds himself in, so has really made the call for that to come about and to also be deployed as rapidly as possible. And so I think that it is available is a really good first step. I think it needs to be deployed in an urgent response. It cannot take the same timelines that we would normally see. Otherwise, we're saying that we're not getting the emergency response that we need to fill these gaps.
Yeah, and the distinction there is that while the UNCTAD has called for 2.5 trillion, only 1 trillion has been made available. So who can then fill that particular gap? Or how do you fill that gap?
Well, I mean, I think here we've seen our leaders in Africa come forth and ask for more creative ways where countries who have the ability to voluntarily make those funds available could do so. And I think there have been so far good responses. It's still not enough, and I think we still have to keep the pressure on countries to open up that space to make more funding available. It's clear that we are going to need double figures of GDP to respond to this, and where some parts of the world are able to do it, others are not, and we have not seen that gap filled yet. And yet we've had some time to really consider this. As it were, Dr. Tedros talked about when we will begin to see COVID hit developing countries in the manner that we see it here in the north. Not much time left, and I think that this is what we should have really tried to work towards.
Is it unfortunate or a step back, considering that you have the United States, for instance, that have said that they will hold back funding for the WHO?
I don't think that it is a step back. We would prefer not to have that stand taken. I believe what we have here is the WHO and Dr. Tedros doing the best that they can in this situation, and that right now we need to fight COVID and overcome it. There will always be a time for us to look back at what everyone has done, and accountability put for discourse. But right now we need unity behind the WHO and its leadership to ensure that we get the job done. This needs a global response. And so I think that, that sort of creates perhaps a distraction that is not what we need right now. We need everyone to get behind the efforts that are being made. And at the forefront of this is the WHO and its partners.
Yeah. Does the United Nations then take a similar stance when it comes to the accusations being leveled against the WHO and its initial response, as well as allegations being leveled against the Chinese government, saying that let's take a step back, let's deal with COVID-19, and there will be processes around accountability that will be dealt with at a later stage?
You said it exactly right. Right now, the battle is to defeat COVID. There will always be a day of reckoning. But today, it is unity and solidarity behind getting the job done. People's lives matter, and that's what we need to put at the front of the agenda.
Has there been any state that has been in contact with the United Nations to try and push for an international investigation, whether it is at a later stage? I've heard, for instance, from the Australian government saying that there must be such an investigation.
No, the United Nations to date, I'm not aware that we've had that submission.
Okay, let's quickly then speak about the economic response and how the economies in various countries are taking a knock. And we've heard from the Secretary General saying that recoveries from the crisis must lead to economies that are inclusive and sustainable. How do we get there?
Well, I think, as you heard Dr. Tedros talking about the health challenges and how we must build back better, we have always had on the agenda frameworks to try to get sustainable development done. In this crisis, the opportunity has come. Now, we have an emergency not just in health, but also on the socioeconomic piece. And on the socioeconomic piece, it is a dislocation of the economy, of the informal economy, the formal economy, because of the actions we have to take to stop the transmission of the virus. And so while we look at the stimulus packages to ensure that we try to keep jobs afloat, or those that are taken out, learning happening at home, all our businesses, in fact, happening at home, we need to make sure that we can build back better from that. So there could be online education means that we need connectivity. Connectivity is not there at the scale that we need it, and this is something that we could invest in now. Same for energy transitions and off-grid. That's another part of it. Social protection floors and cash transfers to people, particularly those that are faceless to us, that we don't have identities for. This is actually going to be a time where we could profit from that, and we can put that in place.
Another conversation to be had is, of course, the discussion around economic sanctions that are faced by various other countries. What's the United Nations take on this, and how you can help certain countries like Zimbabwe, for instance, like Cuba as well, to make sure that they're able to respond to COVID-19 while under economic sanctions? Or is the United Nations saying that let's put that aside for now?
Absolutely not. The UN Secretary General has had the call for ceasefires, because the context in which we are dealing with COVID, we really need peace and we need a ceasefire. And that has been signed on to by over 120 countries so far. In the same context, we've asked for the lifting of sanctions, because that also will help enable countries that have sanctions imposed upon them to deal with the supplies that they need for the health of their people. So we have made those two calls, and we continue to put pressure and to bring the global community behind that until we get the job done.
What are the consequences if those sanctions are not lifted?
Well, people suffer. I mean, at the end of the day, if medical supplies cannot get, the treatment cannot get there, the vaccines cannot get there, the infrastructure that is needed to build the water and sanitation to prevent the spread of the virus, then of course people will die. That's what it means. And that's what we're trying to do. We're trying to reduce the numbers of people that will be affected by the spread of COVID. And, you know, COVID travels across borders.
Yeah.
Where you have sanctions in a country that come under pressure, people will go across borders if they find that they're not safe within them as a result of the inability of that country to provide health services.
And there's also the concern, of course, around world hunger. And earlier on, we had the briefing from David Beasley, who is the head of the World Food Program, indicating that the number of suffering people from hunger could increase from 135 million to 250.
Absolutely. I mean, this is what we're saying. You take people out of an economy. Most of it is your daily living. It's subsistence farming. It's subsistence in terms of that daily earning. And once you take people away from that, then the likelihood of hunger is very, very high. And I think this is where we are really asking for the development part of this agenda to be treated as an emergency. People should not have to choose between whether they are facing the crisis of COVID and the health or hunger. We should address both at the same time. There is a prescription which is having an effect on the patient right now that could create another pandemic on the economic side. And we shouldn't have to choose between one or the other. We should be addressing both at the same time so that we prevent an even bigger humanitarian crisis.
And with that said, also including migrants as well as foreign nationals who may find themselves away from the country, those who are in the diaspora, how do states then respond to that? Because what we've seen in South Africa, for instance, is the South African government has announced a 350 Rand or an $18 grant for people who are unemployed. But the big question for some NGOs is, what about migrants who live in the country who are also affected by these economic lockdown?
Well, every human being has the right to expect to have their issues addressed for survival. It's a basic right. And I think that what we're finding ourselves in is an unprecedented situation where we don't have the answers to everything. We have to create the policies and the spaces to make sure that everyone within our borders is attended to. And that includes migrants and includes internally displaced people, refugees. These are all human beings. This is a human crisis. It's one of a global nature. There is no one that has not been affected. And I think that this is where we stand up as a human family. And we try to work across the red tape that there is. Today, we ought to be standing shoulder to shoulder as a human family.
Do you coordinate that type of response from a national government level, or do you escalate it to have it, for instance, at a continental level, or let's say the African Union gets involved, and this is the African Union's response to people who are in the diaspora?
Yes, I think it is first and foremost a national issue, but always when it becomes a cross-border issue, institutions like the African Union have an important role to play. And I think that, right now the African Union is headed up by a leader that everyone has respect for and that understands these issues. So I do think that the African Union is addressing this. I think that they will then work with international organizations like the United Nations, and that, humanitarian law and the respect for human rights will be at the forefront for every African.
What about people who are in the diaspora who are trying to travel back to their homes, but however, though, the countries are not responding, for them at least, positively to try and evacuate them and get them back to their home state?
This is very difficult. I mean, we really have huge challenges with travel right now. And I think where people are and they can remain and to make sure that they are safe indoors, this is what needs to happen. Where there are possibilities and countries are making the efforts to repatriate their nationals, then it is happening. I think in some places it's happening, other places it's slower to happen. The ideal today is not always possible because the competing demands on very difficult resources are certainly there.
We're also seeing shocking numbers in relation to gender-based violence escalating during this period. Some countries even reporting that the number of GBV cases have increased by more than 30%.
Absolutely, 3 times the normal rates. We are seeing it across the world. This is another silent pandemic, if you would. It's a very serious one. Again, the SG's call on gender-based violence, followed up by his policy paper on women's rights and the issues are things that we need to take into cognizance as we are designing these programs to address COVID. It is violence against women. It is violence that children will be seen in that environment, and so will be affected because it is in that space in the family. But we're also seeing online a lot of child abuse online, and these are all issues that need to be taken care of. I mean, the other side of it, of course, is there's many mental health issues that are coming out for our health workers on the front line and in homes.
Yeah. Final one is some leaders are saying, of course, there is some light at the end of the tunnel. So the big question would be that with the UN's General Assembly in September, the UN 75th anniversary, will that still go ahead as planned?
By the grace of God. Yes, I'm very optimistic that it will go ahead. I think that what you will find is that we are going to become even more creative in this space. Today, you and I are having this conversation across 2 continents, and we are communicating with a huge audience. The General Assembly will continue to function, and it will find a way to meet and to address the needs and the aspirations of people around the world that belong to this incredible institution.
Thank you so much, DSG.
You're welcome. Thank you. Be safe.
Thanks a lot. We'll try to be safe, and always remember to wash those hands as well. That was Amina Mohammed, the Deputy Secretary General of the United Nations, speaking to us live from New York. And we close the show on a rather somber note. Seasoned veteran journalist and African Perspective contributor Johnson Barraza has passed away. The Kenyan video journalist with an illustrious career, spending 3 decades, died on Tuesday. Working across the continent, some of his works include covering former South African President Nelson Mandela, the first Ebola outbreak in the 1990s, as well as most of the African Union summit. Johnson Barraza's work spoke for itself. He had a deep love for telling African stories, from covering the conflict in Somalia and the Rwandan genocide in 1994, as well as covering the state presidents, including former President Nelson Mandela, as well as Thabo Mbeki. Barraza's experience on the front line led to him to become an obvious mentor to journalists all across the continent, can I just say, including myself, teaching and sharing his passion for journalism. He leaves behind his wife and 6 children. We are now joined by the SABC foreign editor, Sophie Mokoena, and on the line we will be joined by one of our colleagues, Sarah Kimani, who's actually worked with him for a very long time. And Sophie, when I saw the tweet from Sarah, I was shocked. I called you immediately, and you said, yep, this is it.
Yes, yeah. You know, this is a man who has worked for SABC for 2 decades, and he was there to assist us, particularly when I became a foreign editor. My intention was to ensure that I cover the continent comprehensively, and he was one person who had traveled, you know, around the continent. He knew an African story very well, and he was there to guide me. And yeah, he was a hard worker, a very humble person. And like you earlier on indicated, he was involved in interviews such as Mandela, Mbeki, Zuma, even the last one with our President Ramaphosa at the AU summit. He was really a humble person. Yeah.
Let's quickly go to Sarah Kimani, who's joining us on the line. Sarah, good evening. Quite a somber note, of course. I tried to call you last night, but you didn't answer. Send a voice note as well. But I just want to say to you, condolences. And by the way, as our viewers may not know this, Sarah has been working with Barraza. So every time you see Sarah on the screen, you know that the person who's behind the camera is actually Barraza. So condolences to you, Sarah. I don't know what you have to say at this point.
It's indeed a great loss to the South African Broadcasting Corporation, to his family, to the journalism fraternity here in Kenya. On the continent, we've been receiving messages of condolences from across the continent, but also for his family. Now, Barraza was a man who was different. He valued education, he valued Africa, and he valued everybody that he met. And he loved the African story. Every time we sat in the newsroom or every time we sat in a group as journalists, all Barraza would talk to us about is the various stories that he has covered across the continent. And in all those stories that he told us, never did I ever hear him say anything bad about a person. He may laugh or joke about our continent and the problems sometimes the continent has, but he always had so much hope and belief in the continent. Imagine a man who covered the South Sudan peace talks from the time South Sudanese were fighting South Sudan and Sudan, covered all those talks all the way to the Sudan, South Sudan being a nation.
Yeah.
He covered all the post-independent presidents of South Africa. So we have lost a great man, but most of all, his children have lost a father, a man who worked so hard. And by the time he was resting yesterday, Barraza had educated all his 6 children to university level.
Oh, thank you so much for that tribute to Sarah. And I remember running around with him in Kibera as well. There was no place for him that was a no-go zone. Let's quickly go to Lenius Kakai, who's also joining us on the line. Lenius, what comes to your mind when you think of Johnson Barraza?
Well, the industry, the journalism and media industry has lost a consummate professional. Johnson Barraza was not just hardworking, but was also had a nose for news and a commitment to telling the story from the beginning to its end. And I traveled with him to many, many stories, some of them that required a lot of time just to get through. Some of them very, very difficult stories like the Congo War that we covered. And of course, I'll not forget the Burundi peace process led by former President Nelson Mandela.
Lenius, unfortunately, we've run out of time there, Lenius. We could go on and speak about Johnson Barraza. I've worked with him, as I've said. We've run through Kibera, you know, and for him, as I said, there was absolutely no go zone. Rest in peace, Barraza, award-winning cameraman. We've come to the end of this evening's show. Thank you so much for watching. Enjoy the rest of your evening, and remember to keep safe and take care of your family members, your neighbors, as well as your friends. Goodbye.